So one thing I would love is I think there isn't enough discussion about the possibility of intersex during the prenatal period. Like, I think that should just be part of prenatal treatment, is that, we talk a little bit about, it's possible that you might not have the baby you expect. And one way that might turn out is that you might have an intersex infant, because it is something that we generally don't talk about. There's often so much kind of stigma and shame around it that many folks will keep it quiet, or they don't really know how to talk about it. Even if they do want to talk about it, sometimes you don't really know where to start. And so because of that, I think it's the case that, like, for a lot of folks who end up having intersex kids, they didn't even know that was a possibility. Right? And I think that contributes to the sense of emergency that happens when an intersex infant is born. My other thing is, I would love it if we started thinking about the fertility of intersex people just like the fertility of anyone else, which is that, like, it's not an all or nothing thing. Like, I often say there are a lot of cis folks who require some kind of artificial reproductive technology or some kind of medical assistance in order to build a family. We don't think of those people as out and out infertile or people who shouldn't have children because it was maybe a little bit harder for them to have children than we might expect. That could be true for a lot of intersex folks as well, but we tend to kind of position them as exceptional with regards to these issues of fertility or of perhaps needing some kind of assistance, when, like, that's the truth for a lot of folks. And perhaps really we should be thinking about everyone's kind of equal opportunities to family build if that's what they want.